Hi, I'm Vikas.
Hi, I'm Caesar.
Hi, I'm Elizabeth.
Hi, I'm Asina. Hi, I'm Rosalie.
Vanessa.
Hi, my name is Asina. I'm here to talk about what is pelvic inflammatory disease (PID) is. It's an infection and inflammation on female reproductive organs. It is a sexually transmitted disease. The main bacteria are chlamydia and gonorrhea, and there is two types of PIDs, acute and chronic, where acute is sudden infection and it can lead into severe, and whereas chronic is low-graded infection and only cause mild pain.
Hi, my name is Elizabeth and I'm going to be presenting the epidemiology of pelvic inflammatory disease. The epidemiology of PID is more challenged to evaluate as it shows no symptoms or no signs. Also, because there is underreporting of PID. PID is mostly common in the United States. Over 7 million women in the United States are affected by PID. 1 million of women affected by PID become infertile each year in the United States. About 10% to 15% of women have had an episode of PID in the United States. However, the incidence of PID is on the rise in the United Kingdom due to a rise in sexually transmitted diseases. As the graph shows, the diagnosis in sexually healthy clinics in England went up to a rise in 2009 and 2011. However, they went down in 2012. That's because there was so much rise of sexually transmitted diseases in England, increasing their incidence of PID in the United Kingdom.
Hello, my name is Lucy. I'm going to talk about the causes of pelvic inflammatory disease, PID. The main causes of PID are chlamydia trachomonas and Neisseria gonorrhea, which are both gram-negative bacteria. Researchers have shown that in developed countries, 2 to 5% of women got PID through gonorrhea infection, and 15 to 30% through trachomonas infection. There are different ways which the bacteria can enter into the body. First of all, we have the sex. Through sex, when the semen enters through the vagina, it goes to the cervix and the fallopian tubes, where you can see the enlargement of the fallopian tubes. The other way can be through childbirth, miscarriage, abortion, the insertion of intrauterine devices, also the biopsy of endometrium. In addition of chlamydia, trachomonas, and gonorrhea, we also have other bacteria that can cause PID, which are Streptococcus species, Staphylococcus species, E. coli, Clostridium species, Bacterioloid species.
There are a number of risk factors associated with pelvic inflammatory disease, which include being sexually active at a young age, under 25, can increase the risk of developing PID. Having multiple sexual partners can also increase, and having history of PID or sexually transmitted diseases can as well increase their risk of developing PID.
Hi guys, today I'll be talking about the signs and symptoms associated with pelvic inflammatory disease. As you can see, I have abdominal pain. Secondly, I have abdominal vaginal bleeding, which can actually cause periods to be heavy. Secondly, it can cause bleeding between periods, and lastly, periods can occur after sex. Number 2, abnormal vaginal discharge is caused by bacterial vaginosis. This is responsible for the nasty smell which is caused during the discharge. Secondly, this bacteria will actually cause excessive bacteria inside the vagina, which may need to be treated by antibiotics. Thirdly, although some of the symptoms can occur quickly, some are known to actually occur slowly, such as abdominal pain. Initially, these pains can be mild but can excessively grow. In some cases, there is no signs or symptoms. However, the person who's actually suffering from PID will not know this until they actually find a major symptom.
Hello, I'm Vanessa, and I'm going to talk about the diagnosis and the treatment. Firstly, I'd like to say that the diagnosis isn't easy to be given because of the variation of signs and symptoms of this disease. It can vary from asymptomatic to high fever. So that's why the healthcare professional should be aware of that and should be trained to detect this disease through clinical examination, which should be supported by further exams, which can be the laparoscopy, which is the most important exam for this disease, microscopy of vaginal secretion, endometrial biopsy, and transvaginal sonography. The treatment is a combination of oral antibiotic regimen and parental therapy. The parental therapy, it should continue until 24 hours after clinical improvement, and the oral therapy should continue until 14 days. And because of the nature of this disease, which is a anaerobic and facultative bacteria disease, it's necessary to use a combination of antibiotics because it should cover this entire bacterial range. And due to the combination of antibiotics, due to this treatment, the clinical treatment response has been positive. It has a positive cure rate. Thank you.
Hi, I'm Vikas, and I'm going to talk about the prognosis of pelvic inflammatory disease. It refers to the likely outcome of the disease, which depends on prompt diagnosis and treatment. With various antibiotics, it might include duration of the disease, consequences, complications, recovery, and mortality rate. Pelvic inflammation and infection responds very well to antibiotics. Most females, they make full recovery without any problems, but some people with initial infection in fallopian tubes or ovaries get a number of complications. In most cases, PID clears up after 10 to 14 days of antibiotic treatments. However, there are some factors affecting the recovery time. If an individual fails to recover within the maximum duration time, then it might be due to reinfection of the disease, use of intrauterine device for contraception, wrong diagnosis test, use of wrong antibiotics, and not following follow-up care.
Hi, I'm Cesar, and I will talk about the complications of pelvic inflammatory disease, which can occur when the treatment is not complete or the patient has a symptomatic infection, which can progress, resulting in serious problems, such as infertility. It's caused by a damage to the fallopian tubes and represent 20% of this case, with highest risk in delayed treatment or repeat episodes. An ectopic pregnancy is when a fertilized egg implants itself outside the uterine cavity. This may lead to severe internal bleeding and represent 9% of the case. A chronic pelvic pain represents 18% of the case, and it is a persistent pain in the lowest part of abdomen and pelvis. This can impact in the daily life, leading to further problems such as depression, stress, insomnia, and pain during intercourse. An abscess represents 15% of the case. This is a collection of infected fluid, is pus, and appears when the infection is severe. A recurrent pelvic inflammatory disease is the most common complication of PID and represents 21% of the case. If the course of the treatment was not complete or a sexual partner has not been tested and treated, the condition can return. Some women are more susceptible to infection once their genital tract have been damaged by previous episodes. Thank you very much.